Hi there, this is Nursing Education Videos. Today I will be going over the stroke, cerebral vascular accidents, NCLEX questions on registerednursern.com. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for the information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. So stroke, CVA, stroke, so another name for it is CVA, so cerebral vascular accident. And these are the NCLEX practice questions for nursing students. A stroke is where there is decreased blood flow to brain cell tissue. This can be due to either a blockage or ruptured blood vessel. In the previous NCLEX review, I explained about other neurological disorders, so be sure to check those out. Check those reviews out. As the nurse, it is important to know the pathophysiology of stroke, the types of drugs used to treat this condition, risk factors, signs and symptoms, and the nursing interventions. Don't forget to watch the lecture on stroke before taking the quiz. This quiz will test your knowledge on stroke, so CVA, in preparation for the NCLEX exam. Question number 1. A patient is admitted with uncontrolled atrial fibrillation. The patient's medication history includes vitamin D supplements and calcium. What type of stroke is this patient at most risk for? A. Ischemic thrombosis. B. Ischemic embolism. C. Hemorrhagic. Or D. Ischemic stenosis. So a patient has uncontrolled atrial fibrillation. Because of atrial fibrillation, there's a risk for blood clot forming in the heart and going to the brain, which can cause a stroke. We will double check the notes just to make sure. So on the notes here it says an ischemic embolism is where a clot has left a part of the body, for example the heart, that could be due to atrial fibrillation. So the clot develops in the heart and travels to the brain, which stops blood flow. A ischemic thrombosis is where the clot forms within the artery wall, within the neck or the brain. This is seen in patients with hyperlipidemia or atherosclerosis. So the answer for this question will be B, ischemic embolism. Question number 2. Which patient below is at most risk for a hemorrhagic stroke? A 65-year-old male patient with carotid stenosis. B, a 89-year-old female with atherosclerosis. C, a 88-year-old male with uncontrolled hypertension and a history of brain aneurysm repair 2 years ago. Or D, a 55-year-old female with atrial flutter. So we will double check the notes here. So for a hemorrhagic stroke, the cause of this type of stroke includes rupture of a brain aneurysm, uncontrolled hypertension or aging blood vessels. So older age. So it would be C, a 88-year-old male with uncontrolled hypertension and a history of brain aneurysm repair 2 years ago. Question number 3. You're educating a patient about transient ischemic attacks, TIAs. Select all the options that are incorrect about this condition. Answer A, TIAs are caused by a temporary decrease in the blood flow to the brain. TIAs produce signs and symptoms that can last for several weeks to months. A TIAs is a warning sign that an impending stroke may occur. TIAs don't require medical treatment. So this would be looking for an incorrect statement about this condition. We will double check over here. So on the notes here, TIA, transient ischemic attack, is where signs and symptoms of a stroke occurs but lasts only a few minutes to hours and resolves. It is a warning sign an impending stroke may occur. If this occurs, patient needs to seek treatment. So answer B, it says signs and symptoms that can last for several weeks to months. But on the notes here it says TIAs, this is where signs and symptoms of a stroke occurs but lasts only a few minutes to hours and resolves. So I think it says select all the options that are incorrect with this condition. So B would be one, and then D, where TIAs don't require medical treatment. It says if this occurs, the patient needs to seek treatment. Question number 4. A patient who suffered a stroke 1 month ago is experiencing hearing problems along with issues learning and showing emotion. On the MRI, what lobe in the brain do you expect to be affected? So issues learning and showing emotion. A, frontal lobe, B, occipital lobe, C, parietal lobe, or D, temporal lobe. We'll review the notes over here. So it says here the temporal lobe is where hearing, learning, and feelings happens. So issues with learning and showing emotions could be the answer D, temporal lobe. Question number 5. A patient's MRI imaging shows damage to the cerebellum a week after the patient suffered a stroke. What assessment findings would correlate with this MRI finding? So the cerebellum here, it says balance and coordination. The answers here says A, vision problems, B, balance impairment, C, language difficulty, or D, impaired short-term memory. So it would be B, balance impairment. Question number 6. A patient is demonstrating signs and symptoms of stroke. The patient reports loss of vision. What area of the brain do you suspect is affected based on this finding? A, brainstem, B, hippocampus, C, parietal lobe, or D, occipital lobe. So the occipital lobe says here is vision and color perception. So it would be D, occipital lobes, where the patient reports loss of vision. Question number 7. A patient has right side brain damage from a stroke. Select all the signs and symptoms that occur with this type of stroke. A, right side hemiplegia. B, confusion on date, time, and place. C, aphasia. D, unilateral neglect. E, aware of limitations. F, impulsive. G, short attention span, or H, agraphia. So we are looking for right side brain damage from stroke. So if it's a right side brain damage, it would affect the left side weakness. So for left side, it says right side brain damage can cause confused date, time, and place. So B. Aphasia is left side brain damage. Unilateral neglect. So D is correct. Aware of limitations isn't correct. Then impulsive. Okay, so a patient has right side brain damage from a stroke. Select all the signs and symptoms that occur with this type of stroke. Here would be B, confusion on date, time, and place. D, unilateral neglect. F, impulsive. And G, short attention span. Question number 8. You're educating a group of nursing students about left side brain damage. Select all the signs and symptoms noted within this type of stroke. So aphasia, impaired math skills, C. Issues with seeing on the right side, D. depression and anger. F, agraphia, which is can't write. So the answers to this question were a patient experiences a left side brain damage, it would be the signs and symptoms for this stroke is A, aphasia, C, impaired math skills, D, issues with C on the right side, F, depression and anger, and H, agraphia. Question number 9. During discharge teaching for a patient who experienced a mild stroke, you are providing details on how to eliminate risk factors from experiencing another stroke. Which risk factors below are which risk factors below for stroke are modifiable? So A, smoking, B, family history, C, advanced age, D, obesity, or E, sedentary lifestyle. To the notes over here. The mnemonic is strokes happen. So it could be modifiable versus unmodifiable risk factors. The modifiable are A, stroking, D, obesity, and E, sedentary lifestyle. Okay. Question number 10. Your patient who had a stroke has issues with understanding speech. What type of aphasia is this patient experiencing? And what area of the brain is affected? So it has issues with understanding speech. So it says here, it's a receptive aphasia, unable to comprehend speech, which is Wernicke's area. So the answers here, it says A, expressive Wernicke's area, B, receptive Broca's area, C, expressive hippocampus area, or D, receptive Wernicke's area. It's D. Question number 11. Your patient has expressive aphasia. Select all the ways to effectively communicate with this patient. A, fill in the words for the patient they can't say. B, don't repeat questions. C, ask questions that require a simple response. D, use a communication board. Or E, discourage the patient from using words. So they are able to comprehend speech but can't respond back. It's to be patient and let them speak, be direct and simple when asking questions, give options, and communication via dry erase board. So this question asks, select all the ways to effectively communicate with this patient. D, use a communication board. So C, ask questions that require simple response. Okay, we will go with that and see how the quiz goes. So C, ask questions that require a simple response, and D, use a communication board. Question number 12. While conversing with a patient who had a stroke 6 months ago, you note their speech is hard to understand and slurred. This is known as A, dysarthria, B, apraxia, C, alexia, or D, dysphagia. So you note their speech is hard to understand and slurred. So it's dysarthria, A, based on the notes. Question number 13. You're reading the physician's history and physical assessment report. You note the physician wrote that the patient has apraxia. What assessment finding in your morning assessment correlates with this condition? So apraxia, according to notes here, is can't perform voluntarily movements such as winking, moving arm to scratch an itch, even though muscle functions is normal. So they can't perform voluntarily movements. So the answers here would be C. The patient is unable to wink or move his arm to scratch his skin. (14) You need to obtain information, or you need to obtain informed consent from a patient for a procedure. The patient experienced a stroke 3 months ago. The patient is unable to sign the consent form because he can't write. This is known as what? A, agraphia is lost ability to write. Question number 15. You're assessing your patient's pupil size and vision after a stroke. The patient says they can only see half the objects of the room. You document this finding as hemianopia is limited vision in half of the visual field. Question number 16. A patient who has hemianopia is at risk for injury. What can you educate the patient to perform regularly to prevent injury? So it would be C, scanning the room from side to side frequently. Question number 17. You receive a patient who is suspected of experiencing stroke from EMS. You conduct a stroke assessment with the NIH stroke scale. The patient scores a 40. According to the scale, the result is so between 21 to 42, it is severe symptoms, according to the notes here. So it would be B, severe stroke symptoms for a score of 40. Question number 18. In order for tissue plasminogen activator, so TPA, to be most effective in the treatment of stroke, it must be administered look at the notes here. I think it's 3 hours after the onset. So to be most effective in the treatment of stroke, it must be administered 3 hours after the onset. So on the notes here it says it must be given within 3 hours from the onset of stroke symptoms. It can be given 3 to 4.5 hours after onset if strict criteria is met. So C, 3 hours after the onset of stroke symptoms. Question number 19. Which patients are not a candidate for tissue plasminogen activator for the treatment of stroke? A patient with a CT scan that is negative, a patient whose blood pressure is 200 over 110, a patient who is showing signs and symptoms of ischemic stroke, a patient who received heparin 24 hours ago. We'll look at the notes over here. To receive TPA, the patient should have a CT of the head that is negative for hemorrhage. Labs within normal limits, such as glucose, iron, or platelets. BP needs to be controlled. Systolic blood pressure less than 185, and diastolic pressure less than 110. So it would be a patient whose blood pressure is 200 over 110. Question number 20. You're assisting a patient who has right side hemiparesis and dysphagia with eating. It is very important to so the answers that are provided here could be A, keep the head of bed less than 30 degrees. B, check for poaching of food in the right cheek. C, prevent aspiration by thinning the fluids. D, have the patient extend the neck upward away from the chest while eating. So the notes here is that the diet May need thickened fluids, so thickened liquids, and mechanical soft foods. Assist with eating and monitor for pouching of food in cheek on the affected side. This increases risk of aspiration. And have patient tuck in chin to their chest while swallowing. So it would be check for pouching of food in the right cheek, B. Question number 21. A patient has experienced right side brain damage. You note the patient is experiencing neglect syndrome. What nursing intervention will you include in the patient's plan of care? A. Remind the patient to use and touch both sides of the body daily. B. Offer the patient a soft mechanical diet with honey thick liquids. C. Ask direct questions that require one-word responses. Or D. Offer the bedpan and bedside commode every 2 hours. So neglect syndrome tends to happen in the right side of the brain damage. According to the notes here, the patient is at risk for injury because the patient ignores the affected side. So remind the patient to use and touch both sides of the body daily. Must make a conscious effort to do so, and educate the patient about the importance of turning the head side to side to prevent injury on the affected side. So A. So I'm going to go enter the answers and see what I get. Okay, so here are your results. So my results is your grade is A. Percentage of what you got right is 95. So we will see what I got wrong. So question number 19, which patients are not a candidate for tissue plasminogen activator, TPA, for the treatment of stroke? I wrote B, a patient whose blood pressure is 200 over 110. The answers are B and D. So patients who are experiencing signs and symptoms of a hemorrhagic stroke, who has a BP for greater than 185 over 110 and has received heparin or any other anticoagulants, etc., are not a candidate for TPA. TPA is only for an ischemic stroke. So that's a good learning experience. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursrn.com for more information and check out their YouTube channel. Again, thank you. I hope everyone has a great day.